Most of us grew up believing that more health tests mean better care. The more screenings, the earlier the problems found, right? Well, not always. Especially after age 70, some routine checkups might do more harm than good. It's a surprising truth that more and more doctors are recognizing, and it's time you did too. Medicine isn't one size fits all. What was once a lifesaver in your 50s or 60s can quietly become a risk factor in your 70s, 80s, and beyond. Your body changes, your health priorities shift, and so should your approach to testing. Let's start with one of the most common and misunderstood: the colonoscopy trap. For decades, colonoscopy has been hailed as the gold standard to prevent colon cancer. No doubt, in your younger years, this test saved countless lives by catching early warning signs. But after 70, especially if you're feeling healthy and have no digestive symptoms or family history, this test isn't the harmless checkup it once was. Why? First, the preparation. The bowel cleansing involves strong laxatives that can cause dehydration and electrolyte imbalances. Your kidneys and heart, both more sensitive as you age, can be seriously strained. Then, the sedation needed to get through the procedure lingers longer in older adults, causing confusion, dizziness, and increasing the risk of falls. But the biggest concern? The findings that may never have caused problems. Polyps. Small growths are often slow growers. Many take 10 to 15 years to develop into something harmful. For someone well past 70, that something harmful might never happen. Yet once these polyps are found, it often triggers a domino effect. Repeat colonoscopies, biopsies, even partial bowel surgeries. These interventions come with real risks. Infections, bleeding, hospital stays that can seriously impact your quality of life. Here's a story that stays with me. George, an active 82-year-old with no digestive issues, agreed to a routine colonoscopy. During prep, he became severely dehydrated. Afterward, still groggy from sedation, he fell at home and fractured his hip. Months of rehab followed, along with medical bills and stress, and the colonoscopy showed nothing alarming. George's story is not rare. It reminds us that saying yes to every test isn't always the safest choice. The good news? There are now safer, non-invasive alternatives like stool-based tests that screen for colon cancer without the risks of colonoscopy prep and sedation. If you're a modern and unstoppable senior, you deserve health care that honors your body's unique needs. That means thoughtful testing, not unnecessary procedures. Before we dive into the next health checkup to watch out for, drop the first letter of your name in the comments below and add a heart emoji. It's a simple way to bless your wellness journey and let us know you're here, walking this path with us in the Wellness for Modern Seniors community. And if something in this message speaks to your heart, go ahead and tap that like button. It blesses your journey and helps bring this message to other modern and unstoppable seniors who need it too. Imagine lying inside a machine that scans your entire body, uncovering every tiny shadow or spot before you even have symptoms. Sounds like the ultimate prevention, right? But for modern and unstoppable seniors over 70, full body scans can become a Pandora's box of worry and risky procedures. Full body CT scans and MRIs are incredibly sensitive. They catch everything, even harmless abnormalities that would never affect your health or lifespan. Doctors call these incidental findings. But for you, they can become ticking time bombs in your mind. A small nodule here, a shadow there. Suddenly you're stuck in a cycle of follow-up tests, biopsies, and specialist visits. And that's just the start. For seniors, these follow-ups aren't simple. A biopsy that would be routine at 45 might cause serious complications after 70. Collapsed lungs, infections, weeks of recovery. Even holding still during an MRI can be painful or exhausting for older joints. And the emotional weight? It's heavy. Constant worry about what might be lurking eats away at your peace of mind. Instead of enjoying your health, you live in fear of what if. Take Betty, a vibrant 78-year-old woman who walked daily with energy and no complaints. At a health fair, she agreed to a discounted full-body scan. The scan found a tiny kidney lesion, something that hadn't caused any issues and likely never would. But the word lesion sparked panic. Within weeks, Betty was in surgery. The recovery drained her energy for months, and she faced complications that never fully healed. All for something that might have stayed silent forever. This is called overdiagnosis, finding problems that aren't really problems. It's an emotional and financial drain that many seniors don't need. Another common screening to be cautious about is the cardiac stress test. For years, the treadmill stress test has been a go-to for detecting heart disease. The idea: push your heart to its limits and watch how it responds. In your 50s and early 60s, it can be useful. But after 70, the story changes. Aging bodies naturally change. Arteries stiffen, blood pressure fluctuates, electrical heart patterns shift. These normal changes can show up as abnormal on a stress test, leading to false alarms. False positives can set off a dangerous chain reaction. Angiograms, catheterizations, stent placements, even bypass surgeries, all carrying serious risks. For seniors, these procedures aren't minor inconveniences. Bleeding, kidney damage from contrast dyes, dangerous blood pressure drops, and difficult recoveries can follow. George, a 74-year-old retired bus driver, experienced this firsthand. With no symptoms and no chest pain, his routine stress test came back borderline. That led to a cardiologist visit, angioplasty, a severe infection, ICU stay, and 6 months of rehab. His quality of life was never the same. The question is, was that treadmill test worth it? Modern wisdom says heart testing after 70 should be guided by symptoms and overall health, not routine screens. If you're finding value in these insights, don't forget to hit like. It's a small act that blesses this community and helps spread wellness to more modern and unstoppable seniors, just like you. Now let's talk about 2 screenings that seem routine, but can often lead to more harm than good after 70. The PSA test for prostate cancer and routine thyroid screening. First up, the PSA test, a blood test many men know well. It measures prostate-specific antigen, a protein that can be higher in prostate cancer. Sounds straightforward, right? But here's the catch. After 70, the PSA test often flags harmless prostate changes that don't need treatment. Most prostate cancers in older men grow very slowly. They're unlikely to cause problems in your lifetime. Yet a high PSA result can trigger a biopsy, an uncomfortable, invasive procedure, or even surgery. These treatments carry risks like incontinence, erectile dysfunction, and infections. Imagine facing these side effects for a cancer that might never have harmed you. That's why many experts now recommend watchful waiting and shared decision-making instead of routine PSA testing after 70. It's about choosing quality of life over aggressive interventions. Next, the thyroid screening. Thyroid problems often sneak in with age, but slight abnormalities in thyroid hormone levels are common in seniors and don't always require treatment. Over-medicating with thyroid hormones can do more harm than good, causing heart palpitations, bone loss, or increased risk of falls. Instead of routine thyroid tests, pay attention to symptoms like unexplained weight changes, fatigue, or mood shifts. Let your doctor help you decide if treatment is truly necessary. Both these tests highlight an important truth. More testing isn't always better. It's smarter to listen to your body, work closely with your doctor, and avoid interventions that don't improve your well-being. If you haven't already, subscribe and click the bell so you never miss a care tip tailored just for you. We've talked about 5 common health checkups that after 70 may do more harm than good. Colonoscopies, full body scans, cardiac stress tests, PSA testing, and routine thyroid screening. The common thread? Overdiagnosis and overtreatment can quietly steal your energy, peace of mind, and even your quality of life. After 70, the goal of healthcare shifts. It's no longer just about chasing every risk or silent abnormality. Instead, it's about smart, personalized care that honors your body, your lifestyle, and your priorities. Preventive care is still important, but it must be balanced with caution, weighing the real risks and benefits of every test or procedure. Sometimes less is truly more. Remember George, Betty, and the many seniors whose lives were changed not by illness, but by the fallout of unnecessary medical interventions. Their stories remind us that protecting your health doesn't always mean doing everything possible. Sometimes it means choosing wisely and protecting your quality of life above all. To all my modern and unstoppable seniors watching today, you're not neglecting your health by being cautious. You're honoring it. If you haven't already, subscribe and click the bell so you never miss a care tip tailored just for you. Together, we're building a community of seniors who choose empowerment over fear, wisdom over overwhelm, and wellness on their own terms. Thank you for being here. Stay strong, stay unstoppable, and keep prioritizing your health in the ways that truly matter.